Want to go to the next question. The next question will be about telepsychiatry. And one thing that we've noticed as executive search consultants focused on behavioral health is telepsychiatry is becoming much more prevalent in the market, both between the candidates and our clients. What I'd love to hear from you, and I think what residents would really appreciate, is your thoughts of what you think telepsychiatry, what role it plays in the current market, and how do you think telepsychiatry will develop and evolve in the future state? Dr. Wakim, let me start with you, please.
Yeah, thank you. Um, so, doing training in West Virginia during residency, there was a lot of rural communities that couldn't access mental health care. So, actually, I trained a fair bit in telepsychiatry. So, I had been doing telepsych work for years into certain outpatient settings and actually some drug and alcohol rehabilitation and detox programs. But obviously, one of the big hangups to that was technology in certain areas, which still exists, especially in again rural West Virginia and areas like it. And the other thing was just this barrier of either providers not feeling comfortable with it or patients not understanding or feeling comfortable with it. And unfortunately, with COVID, that changed overnight, and it became not just doable, but in some instances or a lot of instances preferred for access to care and convenience and a lot of different reasons. So as someone who had been doing telepsych for years pre-COVID, did it all through COVID, and then now doing it kind of on the hopefully what we would call the tail end of this. It is something, as I alluded to earlier, if you're not doing interventional psych and you're not having to place a coil on someone's head or push an IV ketamine infusion, you can perform a lot of what you need to do via tele. So it's certainly not something that's going away. I guess the third piece of the equation was payers, and what we've seen from payers, Medicare, and their stance is this is going to continue to be paid for. There's probably it's not very likely that this is going to be clawed back and the regulations are going to go back to kind of pre-COVID, at least not to the levels of pre-COVID. So, telepsych will be part or certainly an option for care into the future. And then it really goes back to personal preference and then the setting in which you're working. So obviously telepsych into a kind of an acute inpatient lockdown unit where psychosis or thought disorders might be common. Using technology in that instance, again, we had to and we did it, but probably not ideal care and probably not something payers will continue to pay for. But outpatient setting, less acute setting, it is convenient. There are advantages to it. And so I do think it's absolutely something we'll have to embrace we'll have to continue to embrace as a specialty, and certainly something that's here to stay. I don't know that you can get any more telepsych adept than what we were during COVID, where a lot of people were 95+% tele in a lot of organizations. But I definitely think it'll be a huge part of practice and a huge option into the decades to come.
Thank you, Dr. Wakim. Very helpful information, learning your perspective. Dr. Carter, what are your thoughts about the current state of telepsychiatry and what role it will play in the future care delivery team of behavioral health?
It is here to stay. I've written chapters on it. I use it every day. I'm in between two different hospitals, so I literally across town trying to use it every day. Huge advocate. It's expanding access to care. It's a wonderful tool. Just some nuances, just from personal experience, is if you do want to go the telepsychiatry route, I would definitely talk to the organizations that you want to employ or go to work for. Understand what kind of EMR system they have, what type of virtual services that they're actually utilizing, and make sure, just at a very simple level, are they paper charts, which there's still a lot of organizations that are utilizing paper charting or actually using EMR. when you think about that, it's the access of what type of care you're going to have. If you're using paper charts, the charts are, you're not going to see the whole picture of the patient versus their health history within an EMR. That may change your mind about wanting to practice telepsych with that particular organization. Some other just kind of nuances is understand too the type of services that are going to be provided. Are you just being med management? Are they able to access other types of services like therapy or other modalities that are needed? Who are you working with on the other side? Is there a nurse? Is it a mental health tech? Is it a clinician of some sort? Is that person someone that you work well with? And what type of culture are you going into? Are you somebody who is like me, just going across town and dealing with the same type of patient population? Or are you doing like colleagues of mine and practicing in an entirely different state? Do you have the ability to build culture and rapport with the patients that you're interacting with? I think particularly with telepsych, it's a wonderful tool, but there's a lot of nuances that some people think, oh, it's just turning on the screen and meeting a patient. Make sure that you're asking those important questions of what kind of resources and tools and experience that you and the patient may have interacting in that type of system.
Thank you very much, Dr. Carter. And Dr. Krugley, what are your thoughts and your perspective on telemedicine and what's going to happen in the future?
Well, I was first exposed to telepsychiatry over 10 years ago. I was partnered with a psychologist who was trying to start up essentially a telepsychiatry business, and we were working with an outfit from based in California called Forefront Telecare. And the technology was brand new at the time. And we were doing, I was doing nursing home consultation remotely at facilities in upstate New York from my home. So I do have, a decent amount of experience with telepsychiatry. Now, I agree with what's been said. It's certainly not going away. But what I would say further is that psychiatry in particular lends itself to telepsychiatry, as we are not with the exception of, as Dr. Wakim says, with the exception of some procedures that we do, and maybe there's going to be more of those in the future, but the basic assessment is not a hands-on situation like it is with other areas in medicine. So it's a talking and listening paradigm, which lends itself quite well to telemedicine, telepsychiatry. I do think it's not exactly the same as seeing a patient face-to-face, but it's a reasonable facsimile. And I think that basic assessments, like, for example, emergency room kind of work, where you're doing a one-shot kind of an assessment on someone, I think that kind of work or office assessments lend themselves very, very much so to telepsychiatry, much more so than other areas of medicine. So I think the tele is particularly well suited to psychiatry. I do think that Dr. Carter, or maybe it was Dr. Wakim, said it may not be in certain inpatient situations, or in certain situations, certainly in interventional work, you can't do tele. But I think there are many areas in psychiatry that lend themselves very well to telepsychiatry. And I think the issues of e-scribing and interstate use with various licensure requirements and so forth, which are actually evolving as we speak, I think are going to open up a lot of opportunity for telepsychiatry going forward. It's certainly not going away. It's going to become more a part of clinical practice as time goes on, no doubt.